Okay. It's recording. Gastrointestinal disorders, the key points. Childhood GI disorders may result from infection, inflammation, which are parasitic worms, structural anomalies, an inflammatory response, or difficulty with motility within the GI tract. Gastroenteritis, is the inflammation of the stomach and intestines. It usually accompanies numerous GI disorders, including anorexia, nausea, vomiting, abdominal distension, and diarrhea. Vomiting is common during childhood. It may be self-limiting or indicative of an obstruction or a problem with the GI tract. Diarrhea may be mild to severe, acute or chronic, and may result in mild to severe dehydration. Acute dehydration may follow secondary to upper respiratory or UTI or antibiotic use. Acute infectious diarrhea is the result of various bacterial, viral, or parasitic infections. Onset of gastroenteritis is often abrupt and with rapid loss of fluids and electrolytes from vomiting and diarrhea. Chronic diarrhea is related to chronic conditions such as malabsorption syndrome, lactose intolerance, food allergies, inflammatory bowel disease.
Okay, so some of the things we're going to look for when we do our diagnostic testing are going to be a CBC, that is going to determine anemia or infection, our electrolyte panel, which will tell us if they're dehydrated as well. We're going to commonly test the stool for occult blood and UAs. Some of our common GI viruses or mechanism of disorder would be rotavirus, which I'm sure we're all familiar with if we've had children. Most common manifestations with that are diarrhea, fever, and vomiting for 2 days. Can even be watery diarrhea for up to 5 to 7. E. coli, we would see watery diarrhea for 1 to 2 days, followed by severe abdominal cramping.
Oh, stop. What the hell happened?
Does it only record for so long?
Oh, there you go. It's still going.
Oh.
Sorry.
Okay. Salmonella, nausea and vomiting, abdominal cramping, bloody diarrhea, fever, they may be afebrile, headache, confusion, drowsiness, seizures, and in very extreme cases lead to meningitis or septicemia. C. diff is another one that we're all familiar with this characteristic smell. Mild watery stools for a few days. In the children, it's actually less severe than the adults. C. botulism is abdominal pain, cramping, diarrhea. It may cause respiratory compromise or CNS symptoms. Staph, which is food poisoning, resulting in severe diarrhea, nausea, vomiting. And our final one, which is extremely common in children and very contagious and communicable, is pinworms. You would see perianal itching, enuresis, sleeplessness, restlessness, and irritability due to itching. Again, on our diagnostic testing for that, they talk about doing a tape test for pinworms where you'd actually place a piece of tape over the child's anus and then send that into the lab to check for the presence of eggs.
One of the other disorders would be the inguinal hernia. Signs and symptoms are painless swelling, extending towards or into the scrotum. Complications are
Incarcerated.
It makes sense to me. Nursing care, surgical pre-post-operative care would be surgery, and discharge instructions. Another hernia would be the umbilical cord hernia. Signs and symptoms of midline swelling of the umbilical area. Complications, incarceration, or strangulated. Nursing care is most resolved spontaneously within 3 to 5 years of age. Surgery or pre-post-operative care on discharge instructions. Anorectal malformations, signs and symptoms are rectal closure, stenosis, or the constricting of the passageway. Complications depend on the defect and accompanying multi-system involvement. The nursing care for that would be extensive treatment depending on the deficit and associated organ involvement, preoperative care, The caregiver would have to have an education and IV fluids. Post-operative care, pain control, signs and symptoms of infection, skin care, NG tube, oral feedings, and discharge instructions.
Okay, and then a couple of the other major ones that our book covers is hypertrophic pyloric stenosis. So signs and symptoms of that for our little guys is going to be mostly in a healthy male infant, and they'd have a new onset of vomiting progressing to projectile. So one of the things they do to diagnose that is actually palpating a pyloric mass, which it states over and over is olive-shaped. Nursing care would include, or also collaborative care, let's say, surgery, because we don't do surgery, but we take care of them after. We'd assess for dehydration, changes in weight, and discomfort. We'd commonly see them be an NPO status and need an NG tube. Post-operative care, and then of course teaching the parents how to care for that incision site, signs and symptoms of infection, and what are their responses to new feedings. Also, the book covers intussusception. Signs and symptoms of that are going to be acute abdominal pain. There's a picture in our textbook of a little one with the legs curled up. Current jelly stools, so it's going to look different in their diaper. Fever, dehydration, abdominal distension, and lethargy and grunting due to pain. The diagnosis for that is based on their history, and it says you would be able to palpate a sausage-shaped mass. The nursing care for that would be barium or air enema to correct that, because it's actually like it's turning inside out on itself. Prompt surgical correction, and you would want to provide information, of course, to the parents, again, and how to care for them. They most commonly are NPO. They have NG tubes. You would need IV fluids for them, of course, and you would be monitoring for perforation or peritonitis. Then another one, and the final one that we'll cover, is malrotation and volvulus. So our signs and symptoms of that would be that it's actually most common in the first month of their life. They would be vomiting intermittently, have abdominal distension, reoccurring pain, palpable epigastric mass, dehydration, and lethargic. The complications are pretty serious for these little ones. It's shock, which the signs of that we all know are tachycardia, tachypnea, hypotension, cool, clammy, cyanotic. And our nursing care, once again, is going to be post-operative. They'd be coming out of surgery, so we'd also have to check for their hydration status, if they have an NG tube or any IV antibiotics. It's basically the same care for little ones as for adults, just the hydration is very critical, and anyone who's had a sick child knows keep them clean and comfortable.
And this was on GI disorders. Thank you.